All right, friends. So now I would like to welcome to the stage, I want to say the Avengers of healthcare in our Kern County community. Let's welcome Emily Duran, Jane Willson, Ken Keller, Dr. Meave, Jenny Lavers, and Maybelle Liquigan. All right, so to get us started, let's do an introduction. We'll treat this as your 30-second commercial. We'll start over here with an intro and a mission statement of your organization or healthcare facility.
Good afternoon. I am Jenny Lavers. I serve as the operations executive for Adventist Health in the Central California network. My mission is to reduce the brothel index.
Okay.
No?
Sounds good.
Okay. My mission is living God's love by inspiring health, wholeness, and hope.
Good morning, everyone. My name is Emily Duran. I'm the CEO of Kern Family Healthcare, and as a representative of over 400,000 individuals in this community, it is our mission to ensure that our members and our community have the best access to care possible.
Good morning. I'm Jane Willson. I'm the Chief Strategy Officer at Valley Children's Healthcare. And our mission is to provide high-quality, comprehensive health care to children, regardless of their ability to pay, and to continuously advocate for their health and well-being.
Thank you.
Good morning again. Maybelle Liquigan, Senior Vice President and Area Manager for Kaiser Permanente, Kern County. Our mission is to provide high-quality, affordable care, and most importantly, to serve the community and help them thrive.
Good morning. Good morning, everyone. My name is Olga Meave. I'm a family physician, and I'm the CEO of Clinica Sierra Vista. We're the largest federally qualified community health center in the county of Kern, and my mission is to improve healthcare outcomes by providing preventative and specialty care, dental, and behavioral health.
Good morning, everybody. Ken Keller, the lone gentleman up here. Part of indicative of healthcare as a whole.
That's right.
I'm the hospital president at Bakersfield Memorial. Very glad to be up here. And as part of Dignity Health, we're here to try to improve the lives of the community, of the lives of the people that we serve in our community.
Okay, so I have questions here. We have 37 minutes as I watch our countdown, and we're going to get right into it. With a shrinking healthcare workforce, what are your organizations doing to work on creating a pipeline of skilled clinicians?
All right, let's get started. It's a very important subject, not just for healthcare providers or people that are in healthcare, but for all of us, because we all need healthcare. So what we're doing at Clinica Sierra Vista is partnering with our community, partnering with universities, partnering with the government at different levels, and also with other community health centers and hospitals around us, because we need to work on building the workforce, like it was mentioned earlier, from a medical assistant all the way to a neurosurgeon. We need more of all of them. So at Clinica, we're increasing our number of internships. We are being present in the community so that people know that there's a future in healthcare. We're not just hiring clinicians, we also need finance people, we need accountants, we need HR, we need facilities, we need IT. So healthcare is a huge industry that needs to grow exponentially to meet the needs of the community. A big focus for us is graduate medical education. The United States does not have enough opportunities for medical students to match into a residency program. So Clinica Sierra Vista proudly has had a teaching health center and a family medicine residency program for the past almost 11 years. We're proud to say that our statistics show that the majority of our graduates stay in Kern County, and if not in Kern County, they stay in the Central Valley. And that is our mission, to bring providers that are culturally competent to care for our patients so that we can improve a community. We can't do it alone, and that's why we partner with others. And we're happy to do that, not just at a MD level, but also nurse practitioners. We have an agreement with CSUV, and we're growing it. Same with public health, medical assistants, and nurses. So that's our main focus. I know that the Medical Board of California shows really dramatic statistics that say that by 2030, 40% of our healthcare workers are expected to retire. And I'm just going to repeat that. 40% of the clinicians, licensed clinicians in the state of California are expected to retire in 5 years. So we all need to pitch in and help each other grow our workforce because we all need healthcare regardless of what we do.
Anyone else that want to chime in on that?
Sure. At Kern Family Healthcare, one of the requirements that we have is to ensure through our partner providers that we have enough physicians in our community, and that ranges from specialty care, enough hospitals, urgent cares, and even lately transportation is something that we're utilizing quite frequently to ensure that our members get to their appointments. A few years ago, we launched an initiative that was really going to focus on healthcare workforce, and our organization invested over $10 million to ensure that we have different levels of healthcare workers. We enhanced nursing programs at Bakersfield College, at CSUB. We launched a nurse practitioner doctorate program. We provided seed money to some residency programs here locally that most of our, again, partners up here are launching or have launched. Morehouse College with Dignity Health, a residency program over at Clinica Sierra Vista, and we're trying to launch a psychiatric residency program. Having the presence of those programs here locally not only ensure that, as you heard the statistics from Dr. Meave, most of the time they do stay within our community. So by bringing them and rotating them through our healthcare infrastructure and system in Kern County, the likelihood of these individuals that are studying to be doctors will stay is very high. We are also looking at creating pathways and working closely with some of our community partners to ensure, again, that our community actually has visibility and opportunity in this field, in the medical field. It's unfortunate. We are in an economic powerhouse, right, within this county. However, we have over 56% of our community that depends on Medi-Cal. So how is it that we can actually help not only provide better doctors and better access to care, but also help our community transform their lives and really break the cycle of poverty by exploring these healthcare opportunities? And so it's important for us, I heard from the education panel, to ensure that our kids in this community actually have exposure and opportunity to work in organizations such as these on the panel. And one exciting thing that we're actually launching this summer is Kern Family Kids, who again are individuals that are on Medi-Cal, we'll have the opportunity. We're going to host about 30 to 40 individuals to work at our organization to also have that exposure of healthcare management and hopefully growing some of the future leaders for our organization.
Thank you. Yes.
I believe that everyone who's up on this stage is doing their part to really try and grow the workforce, whether it's Morehouse, whether it's what Kern Medical is doing in growing physicians. I also know that we are all working hard to grow our nurses. We have 63 nurse residents at one of our hospitals right now. But I thought when we were talking about how are we developing the workforce, what I would focus on is what are we doing for culture and really just about well-being. When you look at all of our healthcare and our workforce, we employ people who span a 40-year age gap. And so how do you ensure that those people have everything that they need, that they have access to all of the resources? I was the first one to make fun of Kyoshi and Blue Zones, and you have to really think about the fact that people want well-being, people want balance, and so what are we doing to ensure that we are growing the workforce? What are we doing to ensure that we're sustaining the workforce? By ensuring we have programs to support people who are working in our hospitals, to support people who continue to provide that care that we all desperately need. My mother is the director of a nursing program at a community college in Valencia, and nobody will tell you what you're doing right or wrong faster than your mother. And so she's the one who tells me, hey, what we're hearing from new grads is this, and what are you thinking about that? Because I think that we have to be agile as we grow our workforce to ensure that we're adjusting with them.
Okay.
Hello. Yes. I also want to add, in terms of retirement, right? Also being a nurse, because of COVID, we see that there's not a lot of interest when it comes to healthcare, and I think we have the responsibility to ensure that we're exposing people early on, right? That's the key. So at Kaiser Permanente, we have a Hippocrates circle where we start with junior high school students, and they shadow the physicians for a few weeks and just learn about medicine, tour the facility, expose them to college, and get them ready for high school. We also have the ability to have pharmacy and select them to be our residents. And the hope of it, and most likely we have been very successful in retaining them here in Kern County. I mentioned earlier, it's important for us to support the school, so providing grants and scholarships at Bakersfield College and Cal State University, Bakersfield, especially for the nurses and mental health workers. And so again, I think that it's a calling for us to understand that it was mentioned this morning that healthcare is one top reason why this community can grow. At the same time, we have the ability to ensure that if we expose them early, and then we allow them to rotate in all of our facilities, most likely, if we provide the culture, they will stay. As we all know, part of our problem here is once they get training here, they end up going to a layer up north. So it's our responsibility to ensure that we give them that pathway so that they can fall in love with Kern County and stay in Kern County.
Thank you. Mr. Keller, you want to expand on the Morehouse and some of that as well?
Well, it's one of the things that we as hospitals in healthcare delivery are also trying to always figure out. How can we get and maintain more physicians in the community? And we're either trying to recruit them, make sure that they like this place, make sure that once they get here, they can earn it and have a wonderful life. At the same time, one of the things that we all figured out is if there's a person that trains in a given locale as a med student or as a resident, there's a greater tendency for them to stay here. Generally speaking, about 60% of physicians practice where they train. So if we're able to train more physicians here, we're able to keep more physicians here. And over the long haul, if we're able to reduce the current need of about 300 additional primary care physicians in Kern County by keeping 6 to 8 to 12 physicians a year, in about 5 or 10 years, that's going to have a significant impact on top of what we'll continue to do in trying to recruit and trying to bring people down from San Francisco or from LA or whatever it might be.
Thank you. Jane?
Yeah, I would just add one thing, and it goes to the wellness. And we're thinking a lot about how do we encourage somebody not to retire, and what do we do from the work-life balance, part-time, use technology. If you're a nurse at the bedside and you've lifted patients, and even though ours are kids, lifting becomes a real challenge. So how can we do things differently to help support them? Can we use work from home for some of our nursing where they don't have to be at the bedside? So we're really looking at how can we sort of bend that curve on the 40% that might retire and help them continue to work, which a lot of them want to do, but just not in the same way that they have been working. Same thing for the physicians as well.
Thank you. Okay, now we're warmed up a bit. Are we ready? Let's not bury the lead here. How would the proposed cuts to the Medicare programs impact your organizations, and how would they impact people that live in Kern County?
You just jumped right into it.
We
didn't
went
you?
right there.
There's a huge discussion, if you don't know, going on in DC right now about whether or not, and if so, how much to cut Medi-Cal and Medicare. For the people that live in the valley, since this is an economic stomach, here's a couple of statistics to think about. Emily just mentioned the first one. 56% of the people that live here are covered through Medi-Cal in one form or another. That is children, it's women, it's elderly, Is it disabled individuals in addition to people that just can't make that federal poverty limit? Secondly, in healthcare, a general number is Medi-Cal pays a provider about 60 cents for every dollar for the provider's service. So in other words, if it costs me $1 to do something, Medi-Cal pays me somewhere about 60, 66 cents, something to that effect. It's a little different with Kern Family because we're contracted and the numbers are a little bit different. But that gap, that 37 cents for every dollar, just to try to break even, is something that we as healthcare providers try to figure out every day as we're caring for about 60% of the people that come in our hospitals or in our physician offices or the physical therapy, whatever. The cuts that are being proposed are going to have a real, demonstrable, and a very precarious impact on people that have health care, whether or not they have access to insurance, providers, physicians, hospitals, and others, compensation, because we rely on Medi-Cal for a significant amount of what we get paid as a result of the care that we provide. And the other thing that's also is we won't necessarily have a way to make those dollars up. And it's going to lead to significant cuts in access to health care. It will lead into significant impact on the service delivery of what hospitals and healthcare providers have the ability to provide. It also is going to have a huge impact on the infrastructure that we're talking about, is creating a sustainable economic engine for Kern County as a whole. So we're hoping, we're educating, we're coaching, we're talking, we're trying to educate those people that have that opportunity to make the decision not to cut Medi-Cal.
Thank you. Anyone else?
I mean, I echo everything that Ken just said, and then just add, ultimately what will happen is emergency rooms are already inundated, and if we cut access to care, patients will end up not getting the preventative care or early detection and treatment that they need, and they will end up in a hospital emergency room where we are not only legally and ethically obligated to care for them, but it's what our mission is. The problem is that healthcare margins are very low. If you are reading the numbers and looking, people are posting negative margins month over month, and the idea of having anyone that earns more than 4 to 5% EBITDA these days is just obsolete. And so if we continue to add to our emergency rooms and inundate really scarce resources, we will end up in a crisis where we don't have enough providers, enough space to treat the number of people who are coming through there.
I concur with that. 75% of our patients are covered by Medi-Cal and other government-related funding. And it's not just the funding reduction, it is the eligibility criteria and moving people into uninsured and into the ED departments. So that would be a significant impact on everything. If we do have the funding cuts to a significant degree, I think we're all going to have to look at programmatic changes, services that we won't be able to provide. So it's not only that they'll be in the ED and needing care, it may not just be there. We may not be able to recruit the specialists that we need to support the patients. And so it's a tremendous ripple effect across our entire system.
I just want to say that as the largest Medi-Cal provider or plan here in this community, I do want to bring light to the fact that it's going to have not only an effect on those individuals that are actually covered by Medi-Cal, and I think that's sometimes the perception is there's just going to be less individuals that are covered through this plan, but the reality is that our contribution through our providers significantly impacts and grows our local infrastructure, our local healthcare infrastructure. So I'm sure most of you are very familiar and maybe have visited Adventist Health, Dignity Hospital, Mercy, whatever hospital. We strongly support them financially through the Medi-Cal revenues. So there's a huge infrastructure impact, not only to the Medi-Cal population, but everyone in this room, because I'm sure if I start naming off doctors, you will raise your hand and say, yes, that's my PCP, that's my physician, that's my specialty, that's the hospital that I go to. So we are a significant part of the overall healthcare infrastructure for our community because more than half of our population relies on the coverage. And as an organization who our entire budget, over 90% of our budget goes out to the community doctors, goes out to ensure that our hospitals can expand and have the best technology in their facilities. Physician groups, adding more clinics, that is all a result of Medi-Cal dollars. So it's important to really, and I'm not sure if there's any elected officials here, I'm sure they're tired of hearing from us already, but it's important to advocate and to know the power that there is in, one, being an advocate for your community, because if there is a significant cut in our Medi-Cal dollars, it is going to impact everyone.
So for Kaiser Permanente, we're very unique in terms of we have 3 entities, right? We have the medical group that provides ambulatory care, and then also inpatient. We have hospitals in the rest of the enterprise, and we also have a health plan, right? So health plan means we are very mindful of our payer mix, whether that's commercial, Medi-Cal, or Medicare. So Kaiser Permanente serves about 1.4 million Medicaid members throughout the enterprise. And Kern County alone in the last 4 years has seen Medicaid membership increase from 7% to 18%. So what I want to highlight is, as we said, healthcare is always evolving. So how are we going to care for this Medicaid population is very important. I'm very passionate when it comes to promoting health equity, and these are the people that truly need and deserve access to care. So it is our responsibility to advocate. And for instance, Congressman Valadao just came to Kaiser Permanente, and we exchanged data and ensure that we cannot afford for these people not to seek care. And to what Jen said, because if they don't seek care, they end up going to the ED, when really we should be focusing on upstream work and also be flexible in terms of not just be scheduled and open a clinic that's 9 to 5. We gotta always meet them where they're at, because that's the only way we could help them thrive.
So really quickly, Clinica Vista cares for approximately 160,000 patients. That's between Kern and Fresno. The 2/3 of our patients are here in this county. 75% of our patients are Medi-Cal, and in good and in bad times, our clinics are full. People in bad times, people lose their jobs, then they need Medi-Cal. So we need more services. So as we correlate everything that has been said during this summit today, if the tariffs or whatever is happening at the national level affects the growth of jobs or job security, that's a shift in the patients that are going to qualify for Medi-Cal. That's an increase in the number of patients that we need to care for. And if we're going to have less resources, it's going to be harder to attract and retain, because providers also want to work in places that have technology, have infrastructure, and have a good environment around them, because they're going to establish their families. So it all snowballs. Advocacy is one of the things that we do at the national and state level as a community health center. And we've been very vocal. And I'm proud to say that the whole county and the whole state of California has been very present at the national level.
Thank you. Healthcare is an important part of any community's economy, and Kern County is no exception. What are the challenges facing pediatric healthcare in our valley, both those unique to pediatrics and those shared with adult providers? This came from Jane. We'll let you start.
Great. So I hate to quote statistics with some economists in the room, but hopefully I've got them right. The declining birth rate is actually one of the things that we've spent a lot of time thinking about. There were about 15,500 deliveries in Kern County in the 2008 timeframe, and there are about 12,000 now. So that's over 20% decline in that 10, 15-year period. And on the surface, that might not seem like a significant issue, but for us, we need about 1 million children to support the kind of care that we provide. Because healthcare is getting more and more specialized, and as that gets more specialized, you want to recruit the specialized physicians. We have a physician that does hand and upper extremity surgery. If you want to go have your child have their hand repaired, you don't want them to do once a year. You want them to do that surgery a lot. And so healthcare is getting a lot more complicated, and we need a lot more patients to be able to support the care that we provide. So the declining birth rate can have an impact on our volumes and what we can do in the future. But it also has an impact on what we were talking about in terms of staffing. If we don't have the population growth to be able to support the people wanting to come in, to be nurses, to be physicians, where are we going to get the residents to come into the training programs that we have? And so, those are just the ripple effects in all the areas that the declining birth rate and population will have. And the forecast in California is that it will be flat going forward. It's not forecast to go up. So that's one thing we think about a lot. And then, as I mentioned, the complexity of care. Just how can we continue to provide the diversity of services that we need to provide? Healthcare is getting more and more complicated, more and more specialized, and being able to continue to provide that care is something we spend a lot of time on as well. We mentioned the financial pressures, and then one that impacts everybody, and the birth rate and staffing will impact everybody as well, but obstetrical care. We're having a tremendous challenge recruiting OBs into the valley, into rural areas. We're seeing birthing centers close, and that means pregnant women are showing up in EDs without having prenatal care, and that is forecast to continue as well. It's a high malpractice specialty to go into, so fewer people want to go into it, and they don't want to work in small group practices. They don't want to be on call 365 days a year. So getting obstetrical training and obstetrical care in the valley, we're very, very worried about.
Okay, following up, what is one area of improvement in the healthcare industry as a whole? This came from Maybelle. I'll let you start.
Well, we all can agree there's many opportunities when it comes to healthcare. Again, we need to evolve as leaders and in terms of how do we tackle all the things that's coming our way, because we have an obligation to our members, right? So if I want to pinpoint again, I think that the most important thing that we could do differently or better is making sure that we're addressing care upstream and address all the drivers of the chronic illness. And so kind of move from offense to defense, right? So that means we really should be focusing on healthcare and not sick care. Because by the time they are in the hospital, it is very late. And also I want to say that with healthcare, we're not just treating medical care. It's very important for us to also ensure that we're addressing social health and mental health. Right now in the hospital, a lot of Medicare population are sicker. We're seeing a lot of high volume of patients that are being hospitalized. So if we're not proactive about that, and so because they are Medicare, it's going to take them longer to recover. So it's really important for us to address this as fast as we can before they even get hospitalized.
One of the things from the hospital side, as Maybelle just mentioned, you'll hear us talk a lot about the next big technology that we just bought, new piece of equipment, growth in terms of new rooms and things to that effect. But at the end of the day, in this county, one of the things that has transcended and really came about being forced to do so during the COVID time is the collaboration across all the healthcare providers in meeting the needs of the community. We all know that we share a part of it. We all know that we can't do it alone, but there is a tremendous amount of coordinated efforts on everything from preventive care to health screenings to, as Maybelle said, keep people healthy, because at the end of the day, you don't want them in a hospital. I don't necessarily want them in my hospital. I tell people all the time, you can come by and say hello, but you don't need to stay. because we are the most expensive part of healthcare with the most complex things that have to get done. And if we can do a better job in maintaining a person's health, it will ultimately improve the care of the communities that we're serving. And the communication, the coordination, the collaboration that we have amongst these providers here is something that you don't see in many other parts of the country.
Thank you.
So no pressure, right? But 100% true, Ken. So one of the things that we're doing at Clinica Vista is we're implementing a different electronic medical record system. We're moving to our own instance of Epic. And Epic is the medical record in which over 90% of our current residents are training on. So that's a huge advantage. When we interview people and we tell them, hey, we're on Epic, they love it. So that's a way to attract and retain. And not just that, but that's going to improve the communication between us and the hospital systems in the community, our health plans, and we're also going to attract specialists. So that I'm very proud of doing that. It's not easy, it's not cheap, but I'm glad that not just us, but other huge community partners are moving in that direction because we need to innovate. We're implementing AI, and we need to stay updated and all these things.
Thank you.
I also echo Ken. We need each other. My mother-in-law was in Memorial's emergency room last night and had a wonderful experience. And it's because everyone has to do their best to treat the community. When we're talking about statistics, let's just talk about the fact that our largest population, if you're looking across Kern County, is our 30-ish population. But our fastest growing population is the 65 plus. So we were growing at the last time they did the analysis at a rate of between 13 to 15% in that elderly population, which means higher utilization of resources. It also means we have to be better at network integration. How do we make sure that people aren't waiting for a referral and waiting for that referral to get processed and then maybe getting that follow-up phone call? It's something that we as a community, as a healthcare society, we don't do well. We don't ensure people get the follow-up care or that next step in their treatment process. And so what I think we've all committed to is how do we ensure that we're partnering and eliminating those barriers to ensure people get the care that they need.
To add to that, I think it's very important that we also make great strides, and we need to be intentional about helping our community understand the importance of preventive health care and taking control of their health. For those of you that maybe have not had extensive experience in healthcare, or just experience in hopefully not going to the hospital, but it is very complex. It's complicated. And when we have, for example, a population where, at least in our membership, we have to have all of our material at a 6th grade level, you can see that there is going to be intimidation, language barriers, education barriers, you name it. These barriers that our members actually forego care, and they just don't know how to navigate the system. Sometimes it's difficult for me. I hate phoning a friend, but sometimes we have to get on the phone and say, hey, Ken, we have a member, we have to do this, because they can't navigate it themselves. So one challenge actually that we're taking on as an organization, and I'm hoping to really, you talked about integration, really empower and put the focus for our provider communities, ensuring that we don't only give care, that we actually provide that education for our members, so they know that when they do get discharged from the hospital, they are not overwhelmed by the 20-page discharge summary that you give them, but they know when to come back for their follow-up visits. And it's important for our members, and especially our kids, to really understand healthcare and know how to navigate it. So I don't want to get into the stats of obesity rates or asthma rates and all of that, but you know that it's very important that we start from a very early age, ensuring that we have education programs in the schools, healthy eating, ensuring that we as healthcare providers are really focusing on how we can empower our kids to eat the right snacks, exercise, drink enough water, go outside and play, forget your tablets, put your phones down, and everyone in this room should be the example, right? Because what our kids see, that is what they will model. So we really are going to have a push, at least in our organization, and try to help some of our healthcare providers to go back to the basics of health. We don't want high utilization at any of the hospitals or having to run to the urgent care, but really ensuring that we are focusing on overall wellness as opposed to intervention.
Thank you. So in our final 5 minutes here, I would like to ask our entire panel how we've faced challenges, and we know they're there. How are we turning obstacles into opportunity, and what are you most proud of? And we'll start at this end.
I think that competition drives a marketplace, and every time one of us does something and does it well and it inspires somebody else to do it and do it better, it only enhances the care in our community. When you look at the AIS Cancer Center, and there are many people in this room who were part of the founding of that 15, 20 years ago, is 50% of people were traveling over the grapevine to get cancer care. And it's not because we didn't have a great option here locally, it's because people needed choices, people needed options, people needed second opinions. And so what I would say the greatest accomplishment and is all of us sitting on a stage together saying that we are going to continue to enhance care in this community. We're going to continue to drive quality. We're going to use facts and statistics to look at it and acknowledge that there are hardships along the way, but that we have to do what's right to make sure that the people, our neighbors, our family members are cared for and cared for well.
I think one of the biggest obstacles that we're facing is obviously with the potential budget cuts. And I think when there are challenges, there's actually opportunity. And I think there's opportunity for us to get better integrated, to be better friends. You talk about competition, yes, that does drive innovation. But at the same time, I think it also provides opportunity to really level set. What is it that our community has? What is it that our community needs? And how we can improve overall care. Will there be cuts? Absolutely. I think every industry will be facing these cuts. But it should just drive our engines to be a lot more innovative and collaborative to ensure that our community, our beautiful Kern County, stays healthy.
So in thinking about the obstacles, think about the obstacles for the children and their families. And, you know, we're 2 hours away on a good day for a lot of people in Kern County. So we really do think about how can we partner, and Ken mentioned partnerships. How do we partner with the providers in Kern County to be able to help kids stay in the county for what services that can be provided here. So we have outpatient and inpatient partnerships. So with Clinica, with Memorial, with Kern Medical, with Omni, we work with anybody that wants to take care of kids to say, how can you do it better in your facility? And that's intentional. We've done it for 10 or 15 years now, and we've really seen the benefit. We also built our Eagle Oak Specialty Care Center. We had 22,000 visits at the Specialty Care Center last year. That would have been 22,000 trips that people would have had to make to Madeira if we hadn't done that. So we really are focused on how we can help provide kids care locally where it makes sense, and then where they need the more complicated tertiary quaternary care, then they need to come to Madeira. But that's something we're very proud of what we've been doing, and we continue to look forward to partnering with everybody here to do that in the future.
Thank you.
It's obvious that we are having a lot of financial pressure in a way that because we gotta acknowledge that our patients are sicker. Ever since COVID, we're not dealing with COVID, but now there's that recovery. So people are getting sicker, and we have to make sure that at the end of the day, I heard everybody's mission statement, and that is just to ensure that we're serving our community. And one thing that I'm really proud of is this is not a competition. We may all work for different organizations, but when we're doing the right thing for the community, trust and believe we all are here to work together, and that's really what I'm so proud of, the people that are sitting in this room and the other healthcare organizations. When it comes to building a community and supporting Kern County, we're all here for each other.
Yes, and to face these obstacles, we need to continue working together. We need to innovate. We need to transform. And but mainly we have to, like Emily said, continue educating our communities. I see healthcare not just as a service, but as the foundation of a sustainable economy. And we need to grow our own. We need to increase the amount of healthcare workers so that we can keep your workforce at work.
Thank you.
You know, as I think about how we collectively would evaluate the opportunities, from my standpoint, I think it's a deliberate, intentional, and consistent rededication every day to the person that's at the focus, at the center, and that's either your members, our patients, and the community at large. And we all collectively figure out ways to beat those challenges and meet the opportunities that come.
All right. So once again, this has been your healthcare panel. Let's give them all a round of applause, please.